What becomes possible when physicians stop hiding their gifts and start sharing their voices? That's what we're talking about today. If you're a doctor, healthcare leader, patient, you belong here. I'm Kim Downey, and this is Stand Up for Doctors Conversations at the Intersection of Connection, Courage, and the Future of Healthcare. This episode is sponsored by Brian Case at Direct Wealth Care, helping physicians navigate the financial stress no one talks about in medicine with conflict free tools and resources. And I would like to welcome Dr. Becca Thompson and welcome back Susan Hart Gaines. Thanks for joining us today, Becca and Susan.
Thank
Thanks for
you.
having us, Kim.
You're welcome. And by way of a very brief introduction, Dr. Rebecca Thompson is a physician, community builder, and author. And Susan R. Gaines is a life and leadership coach, workshop creator, and facilitator, and author. So the connection here is we're all authors. And what would you most like our audience to know about you as we begin our conversation? And feel free to share the titles of your books. Becca, would you like to go first?
Sure, yeah, thanks for the introduction, Kim. As you mentioned, my name is Rebecca Thompson. Please do feel free to call me Becca in conversation. I'm a family medicine and public health physician and the author of the recently published book, Held Together, a shared memoir of motherhood, medicine, and imperfect love. I live in Portland, Oregon, with my husband and our two teenagers and a couple of very beloved rescue cats. And yeah, I've been really grateful for this opportunity to help tell the stories of some of my patients and my medical colleagues and friends in my community and kind of bridge that gap between clinical care and the stories that we all carry about the ways that we care for each other.
And that's beautiful, and stories are so important. So, congratulations, and thank you for bringing that book into the world.
Thank
And
you.
yeah, and now, Susan, what would you like us to know about you?
Well, my name, as you said, is Susan Hart Gaines, and I am a life and leadership coach. I'm also an author, and I wrote the book. It's also a memoir, Prioritize Your Self Care, Reclaiming Your Path to an Extraordinary Life. And it's really the weaving together of personal story and a guide to help others do the same. And, I found that the thread through coaching, and I also teach and writing, is really offering my dark stories, darker, so that the light can shine through. And I'm really hoping that it's an offer and an invitation for others, especially those who live in sort of a disguise a lot, like physicians who often wear a mask and are really, in my clients, I see really scared to share their truth for fear of losing respect, credibility, and possibly even their jobs. So that was my intention with writing and what I do also through my coaching.
Yes, well, that's such important work, and thank you for sharing, and thank you
Thank
also
you.
for bringing your book into the world. So, as we just mentioned, both of you recently put a book out into the world, and that takes courage. And many physicians have been taught to keep their heads down, work hard, and not draw attention to themselves. I'm wondering what you've learned about finding the courage to share your voice and what advice you'd give doctors who feel they have something to say, but they're hesitant to put themselves out there. Becca, would you like to go first?
Yeah, sure. I think that the biggest piece of advice would be just believe that people want to hear your story. And, Susan, you alluded to this and how physicians are often kind of guarded about their stories. So I think, thank you both for raising that topic and acknowledging the hesitancy that so many of us experience. I think to understand kind of what led me to share, what you asked about finding that courage, I think I should tell you a little bit about the backstory, the origin story of Held Together, if that's okay. So, back when I was first finishing up my medical training and starting out on my career, My husband and I endured a string of very complicated pregnancy losses, medical conditions, just a string of unpredictable and chaotic kind of events in trying to create our family. And it was incredibly isolating, even as a physician, maybe even more so as a physician. But as I found my way kind of through those struggles and began to open up and drop some of that mask and share what I'd been through, it felt like everybody around me had a story. My medical colleagues who had been guarding those stories maybe a little too tightly, my patients who wanted to share things more deeply, and just people I'd known for years and I'd never really known the depths of those stories they held, that they carried. I wanted to find a way to preserve all of this and create something useful, something meaningful out of those intersections of our stories. So this is where I reached out to, it turned out to be 21 other women in my people I already knew, just organically, not that I went and solicited a certain kind of story from anybody. These were just the women all around me. So fortunate, right? And try to help them tell like this most compelling version of their story that we could by collaborating on it. And that, Kim, is what gave me the courage. It was the fact of working with them, their partnership, their trust, these other incredible women, and seeing what our stories could mean together. So, over the course of 10 years, we worked on this book, talked about all the ways that our stories intersected. And I think the thing about this book that maybe is even most relevant to your question, Kim, and to your work, Susan, is that of the 22 of us in Held Together, half of us are healthcare professionals ourselves. So everything from all kinds of doctor, family medicine, pediatrics, geriatrics, pathology, child psychiatry, and then also nurse, EMT, psychologist, massage therapist. And I really feel like the fact of us, so many of us being healthcare professionals ourselves, it's a big part of what makes the stories so compelling because it can be incredibly difficult, not just to tell your story, as you've both alluded to, but to accept help as a healer in need. And so when we can reveal that side of it through our stories, and the reader can see people grow and change and allow themselves to let other people in, I think that's fascinating and it's truly empowering too.
Mm-hmm.
You're bringing up something, if I can jump in here, that's really
Please.
a thread, I think, about storytelling is that there's healing in it.
Hmm.
And it's for so many things, but, we realize that we aren't alone. I mean,
Right.
and the key, I think one of the roots of imposter syndrome, which so many doctors struggle with, is this idea that if they only knew, they blank, 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 right? They
Right. Yeah.
wouldn't. And when you put your story out there, as you did, Becca, you gave permission to all those other physicians and other people's stories
Mhm.
as well to like, oh, I'm not alone. I share this in common. And as Marianne Williamson says, you unconsciously give permission to others to do the same. And there's something so freeing and healing about sharing our stories in service of community.
Mhm. Absolutely.
Yeah, that's so well said. And is there anything you'd like to add about yourself finding courage to share your voice and advice you'd give doctors to feel they have something to say but are hesitant to put themselves out there?
Oh, yeah, so much. I'll try to keep it short. um, Courage is one of those funny things that when people say you have so much courage, it's more about feel compelled, right? And so it doesn't feel like courage. However, I will say that I'm an introvert, actually, and I'm not private per se, obviously not, because I put a lot in my book, but I am an introvert. And so it didn't take courage to write it, but the courage came later when I'm like, oh my God, I put that out there. Like,
Mhm.
that is deeply personal. Um, and then I would ask myself, well, is it true? Is this something that I think might benefit somebody else? Then yes. If I put it out there to be sensationalistic or just look at, or victimized or some, then it's not the right reason. But if it's this may be of service to somebody else, that gives me courage. And I keep learning that over and over. I used to have a column with a local magazine that was actually called Personal Gains, my last name, and it went from being a health and fitness column to a personal column about me trying things. And the feedback I got was they just felt less, people felt less alone because I was simply telling them what I was struggling with and how I had seen through it. And so I guess I get courage from knowing that it's really freeing and helpful to others. Otherwise, I couldn't do it.
I love how you distinguish service, right? So
Mm,
I write a lot and held together quite a bit about the difference that I've kind of discovered between helping and serving. And
mm,
I talked a little bit, just a few minutes ago about wanting to help and share these stories that in a way that they would help and accepting help as a healthcare professional in need. But I feel like
yeah.
becoming a patient, so much of that was about how it shaped the care that I would offer as a physician to others. And it changed my perspective from helping to serving, how it's so
Mm,
much more about being on equal footing with the people you're trying to advocate for. You're not holding yourself above them as if you hold an answer that you're just
right.
providing. That's why I don't use the term provider. I'd say clinician, because you're not just providing services or filling in check boxes of what someone requests. You're really trying to walk alongside them, advocate,
Mm.
serve, all of those principles that you were just alluding to.
There's something I think is interesting. A client of mine is all about storytelling. He's in
Mhm.
rural medicine
Mhm.
and storytelling and story listening. And he talks
Mm.
about how much healing there is in that. And I'm curious, Becca, how much it takes to walk that line in American medicine of revealing yourself because that is freeing to others. And yet you have to maintain a certain professionalism. And, you can't say, actually, I'm having a really bad day. And,
Yeah.
but, but I'm curious how you bring that vulnerability and keep your professionalism
Mhm. Yeah,
in your
absolutely.
stories.
I think that's a really important question because, sharing your story as any kind of healthcare professional, it really does help when the people you are serving, caring for, whatever phrase you want to use, right? When they understand that you're human. And that's the
Mm-hmm.
principle behind all of Kim's work too, doctors being human. Um, so I think like whatever it is that helps your patients, let's just use the word patients here, for understanding that you are just as vulnerable in your own way, just as in need of healing as any other human. That's important.
Yes.
But I say think about the context. So I'm not advocating for sharing personal details in professional settings. That's not even necessary. What I think is that we carry the understanding when we are listening more closely, when we are aware of the stories behind everyone's kind of day-to-day lives that we see, the superficial level, right? When we carry that awareness, we still provide better care. And our patients understand implicitly that we are taking their bigger context into account, even if the encounter is a circumscribed, 15-minute clinic visit.
Mm.
There's something really valuable about that understanding that we carry, knowing that when our patients come to us for support, we can see the bigger picture because we've also lived it in some way.
Mhm. Yes, I agree. And going back to when you were talking about helping versus serving, Are you both familiar with Dr. Rachel Naomi
Of
Reming?
course, of
Yeah,
course.
okay. And she has a piece on helping fixing
Hmm.
serving.
Yeah.
And that I liked the way you made that distinction. I thought that was terrific. And Susan did allude to experiencing somewhat of, I guess, what you call a vulnerability hangover. I think that's a Brene Brown term,
Mhm.
possibly. And Rebecca, did that show up for you at all? Or what would you say to doctors who worry about being judged if they speak up, write, create, or share their story?
Well, I mean, I think that we have such privilege as any kind of healthcare professional to be able to let our experiences kind of shape our careers. This really changed the trajectory of what I was doing with my life. I was more in kind of public health, environmental, pediatric research side of things. And when I started going through all these complications, it made me realize that my own experience gave me something more that I could offer. And I went back and did a second residency in family medicine and
Mm.
focusing on women's and children's health and doing a lot of prenatal care and obstetrics. And um, as a side note, I actually started doing that after my third pregnancy loss, before I knew if I would have biological children at least, or have time to pursue an adoption or anything else, being going back to do a busy residency, it was just a huge leap of faith. And so I think just knowing that you can show up, it can make you more of an advocate. It's certainly, all my experiences have made me much more of an advocate. I was always an advocate for reproductive health and reproductive rights, but you really understand at a new level that
Mhm.
you cannot know someone's experience because you are not living it. And when I can amplify the stories of the people that I've met along the way, I mean, that is the best way to care for my community and advocate for the families that I try to serve.
Hmm. If that brings anything to mind for you, Susan, and also what would you say becomes possible when doctors and others use their voice?
Yeah, I would say first and foremost, they become free. They become um, authentic and less alone, and realize that some of the things they keep inside are not as earth shattering or possibly destructive to their reputations as they may have believed for a long time. Um, and I've seen this over and over with my clients. They become lighter. And the other thing that becomes possible is real healing for the physician community, bonding with other physicians, where I think there's more and more isolation among physicians with the loss of the doctor's lounge. And,
Mhm.
you know, physicians are hungry to be real with each other, maybe first and foremost, but with anyone. And then their patients, even if they're not, as you said, Becca, maybe not they're not being inappropriate and unloading on their patient, but the fact that they have a place to be themselves, I think even with their patients, they just show up more real in a way that is healing. There's healing in storytelling. There's healing in being yourself with your
Mhm.
patient. And when you can't fix it, right? And when you
Yeah.
can't, you can be present, and patients feel that. And there's a healing that goes on.
Mhm.
Beautifully put.
Yes, I agree. And this episode will follow one that I just released featuring a lawyer and physician, both in long-term recovery. So
Mm,
they've both shared their story, and they say it's not easy to share their story. And sharing your story does reduce some shame, right? Shame
yeah,
thrives in the darkness.
yeah.
And they very honestly shared that it's not always well received. It's not all I'm going to come out and tell my stories
Mm,
and it's all like rainbows and puppies and unicorns. And in some ways, it actually increased their feelings of shame. So they
oh,
just really raised a flag to say that it's very individual and specific when to share your story, who to share your story with, and what to share about your story.
Hmm.
So I was wondering from each of
Mm,
you, like, what do you feel is like the best and worst thing that could happen? And if you had, if you want to share any positive and or negative experiences since you've come out with your books.
mm,
I mean, I can't really think of any particular negatives, but to me, maybe that's just because, I choose to frame whatever learning experiences as just that, right?
mm,
I'm never going to apologize for trying to be honest about things.
yeah.
Um, Certainly, many of the stories in the book could raise controversy. I mean, they're about end of life decision making, they're about abortion, they're about failed adoptions, they're about things that can be really heartbreaking and frankly controversial in some ways.
Mm,
Um, but I think maybe the reason, maybe I've just ignored and there's something negative that I haven't noticed yet. That's fine with me. But my
mm,
impression really is that uniformly people may or may not have made the same decisions or had the same perspectives that we describe in each of our stories. But telling the stories in this way, it's as if you're walking alongside this person, you get to know
mm,
her, you fully empathize. I mean, you really feel like you can put yourself in her place. And so I think by the time you're deep enough into her story and she maybe makes a decision that you wouldn't make, maybe as a reader, you're a little bit more open to
mm,
understanding what that might be like. And I mean, that's been my hope in putting the stories out there. And any one of us wouldn't necessarily make the same decisions that the people in that story make. And there are contradictory things all over the book about people making different decisions. You can tell that they have different values from each other.
yeah.
And I think that is the message. And that is maybe the most positive thing about it is that, and this is one of many meanings behind the title Held Together, we can hold all these seemingly contradictory things at one time,
Mm,
especially as women, as mothers, as healthcare leaders. Like, we are capable of living in contradiction and knowing that all of those messy parts fit together into a whole that is greater than any
yeah.
one story.
Mm,
That's beautifully said. And it comes
yes.
to mind like remaining curious, right? If people
Mhm.
just stay curious.
Exactly.
And also, it could also in part be related to your audience, like who has read your book and who's
Sure.
given you feedback, as opposed to the doctor and the lawyer that I spoke with, and who their audience was. It might have been a less forgiving audience in some regards.
And I think that's important to think about, even beyond the context of writing and publishing a book that's very personal. I've learned this, especially when I was younger. Think about what I'm looking for when I share my story,
Mm.
and then decide if I'm sharing it with the right person. If I'm looking for, and this is true actually as a writer, when you're first writing it, it's your little baby. And you don't necessarily want to share it with a hard critic who's going to be like, well, how are you going to sell this? Or, you have to know what you're after, or, even say, this is the sort of feedback I'm looking for. So I think, in the case, I don't know the exact stories with the lawyer and the doctor, but, my question would be, what were you looking for? And as you mentioned, Kim, who was the audience? If you're going to a hardware store for groceries, perhaps you need to go to the grocery store. Um,
That's great.
for example.
Well, and I think sometimes you can't always anticipate, right? You can maybe think you're curating or speaking
Yes,
to an audience who will be receptive or understanding, and sometimes you don't know until
you
you
don't.
receive certain reactions, right? and especially in medicine overall, in different healthcare organizations, right? You can have different heads of departments and everything, right? And some would be very supportive and some would not. And sometimes I think you can't really know, right? Until
And
um
that's where the courage comes in, right? Those
Yeah.
two men or men or women
yeah,
are very brave to share their stories, and it takes courage. And the courage is, yes, you may face judgment,
and that,
you may face, and you have to really come back to what you know about your story and what you've learned and why you're sharing it. And you can't control what everyone's going to think.
right.
I
That's
think
true.
about the idea, we say you give a gift and you can only control how you give it. You can't control how it's received or what someone does with it after it's been gifted to them. And I think any kind of writing that we put out into the world is like that, right? We
Mm.
offer it and we can control how we offer it to some degree, where we offer it, how we frame things, and then everything else is not up to us.
Right. And that silence and shame can be deadly. So kudos to everyone who chooses to share their story, right? To help other people. So, Susan, was there anything else you wanted to share about some messages from your book that you would hope our physician audience would take away?
Yeah, I mean, I think taking the courage to be vulnerable is massive. And it may seem like a small thing, it might be the smallest thing, but starting there, maybe where there's less risk, I think you start to build muscle for this. Also, asking for help is really essential, whatever that looks like. Um, and that's something we all need to learn. I'm just now learning. You can ask for help. I think self acceptance has been a huge part of my journey in this is my story, and there's something special and beautiful about each of our stories. And just learning to be okay with that is huge. And also just trying to be myself. And I would ask that doctors, who often talk about authenticity, really try to be themselves. And that includes sharing vulnerabilities in the right place and time, as Becca, not everywhere all at once. But um, I think those are things that physicians can start to practice every day and build the muscle for perhaps bigger sharing when appropriate.
That's great. Becca, what would you like to add?
I think the message I would leave people with, it kind of summarizes a lot of the themes we've touched on, but just listen in terms of,
Mm,
talking to physicians, listen to your patients, listen to your colleagues, listen to yourself
mm,
to know what will sustain your ability to engage in the work that you want, that you find meaningful, and just remember, even when your time is limited, you can carry that knowledge that everyone has a deeper story that informs how they move
mm.
through the world, and you can let that awareness shape the compassion that you can offer to others and to yourself.
That's beautifully said and reminds me of motivational interviewing, which I have done an episode on that. And it brings that to mind as far as the power of listening can't be understated. And also, as Susan said, asking for help.
Mm.
So, thank you both for sharing your stories and these messages. And how can our listeners get in touch with you, Becca?
Yes, I have a website, RebeccaNThompson.com. The N is important. Lots of Rebecca Thompsons out there. This is the only book I've written, and yeah. So the other ones are not me. I will say on the website too, that's a great landing spot for all sorts of resources, all the podcasts, the reviews, all of that. There's an order link if you're able to get the book, either the book or the audiobook or the ebook, any format. There's an order link to benefit Postpartum Support International and their work in maternal and family mental health. So if you're
Mm.
able to buy through that link and help benefit their work, we would all appreciate that so much on this project. And I also want to point out there's a whole resource section on my website. And
Mm,
this covers hundreds of potential discussion questions and dozens of organized discussion guides around themes, which are great for book clubs, but also my current focus,
mm,
which is for medical teaching programs. So I've been
mm,
traveling around the country and locally here in Oregon to speak with medical students, residents in OB, psychiatry, primary care, anything relevant. I'd love to speak with more nursing groups, social workers, midwives, doulas, anything relevant. Virtual opportunities too. So please be in touch with any ways to collaborate and use some of these stories to help shape the next generation of healthcare professionals and healers. I would be honored and thrilled. I love doing these presentations and conversations along with the collaborators from Health Together. So we'd love to join you. Please be in touch.
Sure. That's terrific. And Susan, feel free
awesome.
to hold your book up again and
Oh,
share with
please.
us how our listeners can get in touch with you.
They can get in touch with me. I think the best way is probably through my website, which is www.wildheart, spelled HART, coaching.com. All one word. And take it or leave it. My book is available on Amazon. And that's it. I do speaking, I do workshops. And especially coaching.
Well, that's terrific. Thanks once again for being my guest, Susan and Becca. This was terrific.
Thank you.
Thanks, Kim.
This
You're
was
well.
really fun. Thank you so much for the opportunity.
Yeah, great to chat with you both.
Yes, you're welcome. And thank you for being part of our Stand Up for Doctors global neighborhood, a place where physicians and those who care about them can connect, empower, recharge, and celebrate. You'll find more stories like this in our White Coats book series. And if you're a doctor, we'd love to welcome you to our inaugural physician retreat this October, where these conversations can continue in person. Would be honored to have you join us. And if you'd like to help sustain this podcast, please consider sponsoring an episode or connecting us with a mission aligned sponsor. Links are in the show notes, including how to reach out to our guests. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.